nerves get to you so bad. This is the reality, I think, of like having high expectations for yourself. I am happy with how it went. I just could not even orientate what part of the body it was. I think it went alright. Feeling good. This is the high in exam period. I've peaked now. Hi everyone, welcome back to my channel. I thought that I would kind of track my progress through exam period, I guess, and just like give you some of my general comments after exams, let you know how I'm getting on. Hope this is interesting. So today is Wednesday the 22nd and it's the day of my first exam, and I've just actually done it and come back from it. And it was, for me, probably the most nerve-wracking one. In fact, it's probably the only one I get properly nervous for, because it's the clinical OSCE. So this is the one where basically we have 6 stations and you go around and you carry out an examination or take a history from a simulated patient. And yeah, this is the one I just think, for me, I just get so nervous about. And I woke up this morning, I felt all right. We have to kind of stay in quarantine for this one, so I had to sit in a lecture theatre for 3 hours before it, just getting myself worked up and more nervous basically. And I did it, and I don't really know what to make of it. During it I was thinking, yeah, this is good, I'm fine, like this is exactly, doing everything exactly as I should. And then I came out of it and I still felt like, yeah, that was right. And then it kind of hit me, all the things I did wrong. And I had a moment of like, oh no, have I actually failed it? And then talking to other people, I realised even more things that I'd forgotten, and I was just getting more and more like, oh my goodness, I've actually failed, or at least I've failed some of the stations. I've lost so many marks. And then I've kind of just rationalised it for the last hour, 2 hours, and I've just decided that I'm alright with it. Like, there were things I forgot, but I think being nervous and in that kind of environment, you're just bound to forget things. Like, I'm not going to remember every single detail. It's just irritating because there was an examination in it that I've practiced day in, day out and could do it all fluently and get every single thing right and not forget any part of it. And then I do it and I do forget something, and it's just a bit like, ugh, why? I feel like OSCE is just one of those exams where you just, the nerves get to you so bad, and it's just, I try to keep myself calm, and I do feel relatively calm. Like I'm not like tripping over my words and things like that. Like I'm able to just kind of take some deep breaths in it, but it's just like when you're nervous, everything just flies out of your head. So we had one, it was like a urine dipstick, so we had to just like test the patient's urine and like see any abnormalities and like explain them to the patient. And I could see that there was blood in the urine, and I had to explain it to the patient, and I said, there's blood in your urine. And then I just forgot every single reason under the sun why there'd be blood in someone's urine. And like, some people that aren't even medically trained like would know reasons why there could be blood in the urine. I did manage to remember a couple, but it's just things like that. I was like, oh, why can't I just remember when I want to remember it? Like any other time I would just know, but just because I was nervous. But yeah, whatever, it's done. Overall I feel like, whatever, it's done. I'm just happy that exams have started. I think I'm getting more and more restless just sitting here like revising every day. I just wanted to finally get one out of the way, so that's 1 out of 6 now done. I'm hoping my written ones are going to go a lot better than that though. I kind of bank on them being better to bring my average up. This was just 10 credits, so it wasn't like one of the big exams that counts for the most. Obviously it's important and it's assessing your clinical skills, so it's going to be important when you're a doctor, but with regards to how much weighting it carries, it wasn't one of the biggest. But yeah, I'm just kind of going to chill about it. There's nothing I could do. Like, I wish I could do some of them again, the stations again, and correct things I did wrong, but I can't, so I'm just going to move on from it. Hi again. So I've just come back from another exam. This one was Medicine 3, and if you've watched my study with me, you'll see that I've done a lot of work for this over the past few weeks. Particularly the last few days I've been doing hours and hours of going over it, revising it, testing myself. And this exam is a multiple choice exam, and it was 80 marks. And yeah, this is the joint biggest weighting exam, so this is worth 30 credits, and so it's worth a lot of this year basically. And yeah, I finished the exam and I felt really good, and I felt like it wasn't
it wasn't that hard. Like obviously it was challenging, but it wasn't ridiculously, I didn't feel out of my depth at all. Like it wasn't ridiculously hard. It's just kind of hit me now how many silly mistakes I've made, and it's just so annoying. This is the reality, I think, of like having high expectations for yourself, because I just can't stop thinking about the few marks that I know I've lost that I should have got. And I know it sounds silly, but basically I've worked out that every mark is worth about 1.25%. And so losing 2 marks, that's actually 2.5%. So then losing 4 marks, that's 5%. And if you think of the difference between getting 65% and getting 70% in the exam, to me that feels like quite a lot. And the fact that I've just counted like 5, maybe more than 5 questions that I knew the answers to, and as I was clicking the answer I thought this is right, and then I changed it to be something that's wrong, and I don't know why I did that, and it's the most irritating feeling. So there was 2 particular ones that I, without a doubt, I knew what the answer was, like without an actual doubt, I just knew. And then somehow I talked myself into changing it to something that deep down I just knew was wrong, and I just don't get it. Like I don't get why I did it, and it just eats me up inside almost, because I can't change it now, I know, but I wish I could just go back to when I was sat in that exam and just tell myself not to do that. And then yeah, I went back through my answers. I had loads of time to spare, so I went back through my answers, and again I changed things that were right to wrong answers, and it's just like the worst feeling. And so I've kind of lost a bit of motivation now. Like obviously I've got 4 exams left, but I'm just feeling a bit like, if I'm going to do all of that work and then go in and do the exam and make stupid mistakes, which I just know are wrong, like why is it worth me spending all this time? And obviously it is, because there's be a lot of marks that I did get from doing good revision, but I don't know, I feel like I'm rambling, and I'm going to tell myself for the next exam not to change my answers, and this is what I do every single time. I say go with your gut, don't change your answers, but I just do, like I just justify it in my head in the exam. I don't know if it's the exam conditions or if it's just, I don't know, it's not nerves. I wasn't nervous, I wasn't stressed at all, I wasn't pushed for time, I was just sat there talking myself out of things I knew were right, and it's just frustrating.
Hi everyone again, so you are due another one of my exam updates. So today I had my medicine 4 exam, so this is the module that's all about the central nervous system, brain. This was one I originally was kind of more confident with, and I thought it's sort of less, well it feels like less content, it's only 6 weeks worth of content rather than 12 weeks worth of content, which medicine 3 was, but yeah, I think the content's kind of like more hard, like it's like harder concepts maybe. Anyway, I just had it, and basically I am happy with how it went. But it's kind of weird because it was a hard exam. I think it was harder than the Med 3 one. And there were questions that I really struggled with. So it's multiple choice again, and it's only an hour this time. And so I'd eliminate all the answers I knew were wrong. And for a lot of questions, I got down to 2 options and I just could not decide between them. So it was kind of just me guessing. But yeah, basically the reason why I feel good about it, despite it being hard and despite me not knowing some of the answers, is that I don't feel like I made stupid mistakes. I didn't feel like I knew something but then changed my answer. If I changed my answer, it was honestly just because I didn't have confidence in what I'd done, and I just changed it because I just didn't know. And yeah, some of them I probably changed from right to wrong, but then maybe some I changed from wrong to right, so it probably will cancel out anyway. But yeah, so I just feel like things I didn't know, I just didn't know. So like I didn't have notes on them from the lectures. I don't know whether or maybe I did have notes on them, but they were just like quite small sections of the lecture that I didn't really take in enough. So if I lost marks on that, I just felt that's fair enough, to be honest. I can't know everything and I didn't know everything, but yeah, there was a lot of stuff that I knew and a lot of stuff I felt like my revision had done me well. But yeah, feeling quite good today. I'm glad I didn't make silly mistakes. I know I changed all my answers, which I really need to learn not to do. And next exam, I'm not going to change my answers unless I'm absolutely certain I'm changing it to the right thing, because my gut instinct always seems to be right. Hey everyone, so you're due another update. Just come back from my 4th exam. Yes, 4th exam. This one is an interesting exam. So this is the one that's kind of got lots of different components to it. And because of that, I kind of find it quite fun in a really nerdy way, because it's just so like interesting. Like you're going from station to station, different exam papers. It's not just sat for ages. So yeah, I'll give you a brief overview of the different components and how it was. So the first part was the anatomy spotter. So we went up to the DR, and then we have a little carousel basically of it's either an image like a CT scan, X-ray, a prosection, so part of the body, like the real body, a picture for like surface anatomy, or a bone. And we go round, you get I think like a minute and a half on each, I can't even remember what the timings are, but you get like not very long on each station. 2 questions are identification for each station, so you have to identify what part of the bone it is or what artery it is or whatever. And then the next 2 questions are follow-up, so there'll be questions about those 2 things, kind of. And anyway, yeah, I thought it was all right. Like, it was hard, and I feel like things they tested were quite specific. But yeah, I think the majority of it I kind of knew. There were a couple of imaging ones that I literally didn't know what it was. Like, I looked at it and I just could not even orientate what part of the body it was. Like, it was either a back muscle, or it was a pelvic muscle, or it was part of the diaphragm. I have no idea. No idea what it was. So there were a few that I literally just made up an answer, because this isn't multiple choice, and so we're not really used to this. Like, we actually have to come up with the answers ourselves. But yeah, a lot of them I did know, and so I'm just kind of going to look at the positives of the ones I did know, and so that was all right. So then after that, so that took about 45 minutes in total to do the spotter exam, and then the other half of the exam was all in a computer room. So we had 3 parts to this. So the first one I did was a prescribing exam. So we got given like a patient who'd just come into hospital, and we had got given what was wrong with them, the drugs they were on, their age, their height, everything like that. And we had to basically prescribe drugs for their condition they'd come in with, and also review the drugs they were on originally when they came into hospital. And we had 15 minutes to do this. And I think that was alright, you know. Basically, it involved prescribing like 3 different drugs. You had to notice that they actually had a penicillin allergy, so not to prescribe penicillin. And you had to also notice that the drug they were on for osteoarthritis would have interacted with the drugs that you newly prescribed, so you had to stop that medication. And then I tried to prescribe something else instead of it, but I didn't really know what I was doing, so I just guessed. But yeah, and a lot of the marks come from just like writing your name, writing the patient's name and the patient's date of birth, and like signing and communicating if they have any allergies, things like that. So I'm hoping that that kind of went all right. Maybe I lost 1 or 2 marks if I didn't fill something in properly, but I'm pretty sure I did. You had to also circle like the times of day you'd give the drugs, and like write the route of drugs, so all of them were oral, so it was just straightforward for that. So yeah, that was alright. It was quite a push for time. We were using the BNF, which is the big sort of Bible of medicine, I guess. It's got like every drug in it, why you prescribe it, how much the dosage is for each drug, the route that you prescribe it, so like oral or like IV. And yeah, so you basically just have to flick through that really fast, and that was kind of what made it a bit faffy and a bit of a stressful, like time pressured one, but I think it went alright. Anyway, so then the rest of that part of the exam, so the part that was in the computer room, I had 2 more tests, and they were on the computer, so they were 10 minutes each. The first one I did was a calculations paper, so it was very straightforward, really, just dosage calculations. So I'd be surprised if I lost any marks on that. All the answers, it was multiple choice for quite a few of them, and all the answers I got were one of the choices, so that kind of looked like a good sign. And then a couple you had to write in yourself, but pretty sure I got all of them. And then the last exam was a 10-minute multiple choice on the computer as well exam about blood test results. So it would be like all the blood test results from a patient, and then it would have questions of what the abnormality they had was likely to be, symptoms they might have with it, that kind of thing. And yeah, that kind of went fine as well, I think. Overall, quite happy with this exam. My second to last exam is tomorrow, and this is the last core exam, so the one that isn't the optional module that I have. And this basically encompasses all of the things we've had exams on so far, apart from the clinical OSCE. So this is going to have Med 3, Med 4 and anatomy in it. And so, and some integrated. So we did you know when you might have seen in my study with me, so we had a few weeks of PBL where we were like doing case studies every week. That can also be in this. So basically it's everything. And so for the rest of the day, I'm going to attempt to go through all of my notes for Med 3 and Med 4, which is all these books. And this is a very unachievable goal. Then I've got to revise my optional module exam, which is a few days after that, and I haven't really started learning for it yet, so that's going to be interesting. See you very soon for when I've actually finished all of my core exams. Hi again! So it's time to update you on my penultimate exam. So I've only got one left, and it feels really good because we've done the core exams now. So we've done like the ones that have all the content that we've learned all year. The only one I've got left is my optional module exam. I'm going to insert a clip now of what my housemates think, because I feel like I've never shown my housemates and it looks like I live on my own and have no friends at uni, but I do. So this is what my housemates are doing with their, well, for some of them, well, one of them, it's their newfound freedom, finished exams, and for most of them they've still got one exam left, so let's see what they're up to. How are you feeling? Good?
Oh, so good, yeah, just glad they're done.
How are you feeling, Sim?
I've got
with your one exam to go and your bottle of whatever that is.
Pause for a second. I feel sad.
no
With one left. I'm stressed.
But they've all gone well-ish, haven't they?
No,
I
they
don't
haven't.
know.
It was painful, but it's done.
Hey! How are you feeling about nearly the end of the exams but not the end of exams?
I can't wait to go out.
Wow, Charlotte's so good on camera. This is Sim just revising for her final exam.
Trying really hard.
She's she's feeling a bit panicked this one, so she's thinking she's just gonna, you know, revise quite a lot now. Very productive. Well done. Keep it up. Keep up the good work. Go on. How are you spending your newfound freedom?
Tidying up.
Oh, I can't wait to finish exams so I can do that too.
It's a brilliant feeling.
Oh, jealous.
Don't think about the exams.
Anyway, I need to update you. So yeah, the exam today could have been on, so the content is anything we've learned this year basically, and I think it went all right. That it's based on 3 cases, and the cases were sort of diabetes, HIV and dementia, which were kind of some of my favourite ones, to be honest. And it's a unidirectional paper, so once you've moved from one screen you can't go back, which is a bit annoying because there was one question where I guessed the answer, moved on to the next screen and it was wrong, and but whatever. Oh yeah, this exam also has like typey boxes in, so like text boxes that you have to type answers into. So my other ones that were on computers, they were all multiple choice, but this one you actually have to type some of your answers out. But they could have been really harsh, but they actually were really nice questions. But yeah, I think of all the exams, this is probably the one that I'm most happy with. I made the least stupid mistakes. I found it the most kind of logical and I could work my way through it quite well. I was always able to locate from the questions sort of the part of my notes, my lecture notes, like that I needed to remember to get the answer. So yeah, it just kind of felt a bit better. And then afterwards we just went to the SU little kind of bar and had a drink, which was nice. And I'm actually going home now for the weekend. And then I'm coming back for my last exam. So yeah, let's hope I get a lot of revision done, because I haven't really started revising for this exam yet. Because it's optional module, I just thought it's not as important as the core exams. But now I'm kind of starting to stress a little bit that I haven't done anything. But I've got a long train journey home, so I can revise on the train. Feeling good. This is the high in exam period. I'm feeling I've peaked now. Can only go downhill from here. One more to go. Hey everyone, I finished exams and I'm so happy. It's honestly the biggest weight off my shoulders now. Like, I don't have to have all the early mornings and the early nights and the hours and hours of sitting at my desk revising and the memorising information again and again, and the constant guilt whenever I'm doing something fun that I should actually be revising, the constant stress and the counting down the days until the next exam. That's it, it's summer, I can't believe it, I'm so happy. The exam itself I just had was an essay exam, and it was basically just one question, there's no choice, and you just had to answer it. And I was slightly annoyed because I learned a lot for the exam, and actually it only asked me about one kind of specific part, and so that was a bit annoying because I just felt like I had so much more knowledge but I couldn't really use it. But I kind of just did the best I could, and I didn't write that much actually, and I normally write pages and pages for essay exams, but I kind of just got to a point where I thought, no, this is fine. Checked over it so many times, finished with like half an hour to spare, but I'm just so happy it's done. I don't even care anymore. Like, I think overall, if I look back on all the exams, I've probably got a 2-1. I'd be very surprised if I didn't get a 2-1. Like, I would be quite disappointed if I didn't, because I feel like the majority of it, like this exam period, has gone well. I've made silly mistakes and things like that, but nothing catastrophic has happened, and in general I just felt like my revision was paying off, sort of thing. I would be very surprised if I got first, just because I just don't think my exams were that deserving of a first, to be honest. I think maybe I'm going to be a couple of % off, but you know what, it doesn't matter. We'll just have to see results today. I don't know why I'm trying to predict. I could literally have got 50 or I could have got 80. I wouldn't even know the difference. I hope this video wasn't just me rambling, and I hope it managed to be quite a good review of all my second year medical school exams. Thank you so much for watching, and I'll see you very soon for lots of videos, summer videos, travelling videos, exciting times. Exam season is over, assuming I don't have to resit anything. I'm gonna be a third year medical student. Woo! Dissertation, here we go. Bye.